I'm looking forward to seeing our business community continue to reopen in the coming weeks as we further wind back the restrictions. While we all want to go back to life as normal as soon as possible, I am encouraging the province to continue its cautious approach. I think we're on the right track. And what's more important than opening before or on a specific date is opening when the data and the health trends say it is safe to do so.
In just over a month, Ontario is set to remove all remaining capacity limits in indoor settings that require proof of vaccination. But some CTV News Toronto sources say the Premier's pushing for new regulations that would speed up the province's reopening plan. This comes as members of the Ontario Science Advisory Table warn that reopening too fast will likely result in a rebound in hospitalization rates. Meanwhile, provinces like Alberta and Saskatchewan plan to remove proof of vaccination and masking policies over the next month.
Here in Toronto, some politicians and medical leaders are in favor of reopening with a revamped, less cautious timeline. Others say not so fast. So can we expect to see, and what are the potential impacts of a faster return to normal life? Here to break it all down is Dr. Lawrence Loh, Medical Officer of Health for Peel Region. We're also joined by Dr. Fahad Razak, internist and epidemiologist at St. Michael's Hospital. To you first, Dr. Razak. Thank you both, first of all, for joining us tonight. But Dr. Razak, do you have any concerns with the province speeding up its reopening plan?
I don't have any concerns right now. We really haven't heard many details about it, but I'd like to see something that is cautious. I think the Ontario government, many times compared to some of our other provinces, has taken a more cautious and measured approach. I hope the same thing will happen here. As a member of the science table, the modeling that you cited that we put out in the last week does suggest there could be a little bit of a rise again if there's too rapid a reopening. Look, for me as a physician and as a scientist, the most important thing to think about is doing this safely. No one wants to go backwards in terms of hospital capacity or other strains. I want those patients who've been waiting for so long for those surgeries and procedures to be prioritized and back on the list and quickly worked on, and society to reopen. So it's just about really sticking the landing at this point. If this is truly the final wave, we don't know, but get to it in a place that allows everyone to do it smoothly. Let's not lurch backwards.
Dr. Loh, in Peel specifically, you have some mayors who are divided on the province's plan. Mississauga Mayor Crombie is urging for a more cautious approach, while Brampton Mayor Patrick Brown says it's time to get back to normal life as quickly as possible. What's your take on the division we're seeing from leaders in your region?
Well, I mean, I think for me, it's really less important to think about the reopening and the restrictions. I mean, ultimately, the science is showing that we are past the peak on Omicron. We are starting to see opportunities where our hospital picture is stabilizing. There is a possibility that we can start to engage in additional interactions and contacts. But I think the bigger thing that we all need to take into account is the fact that we all still have an excellent tool in vaccination in order to actually mitigate any risk associated with any sort of reopening, no matter how quickly it occurs, which is why my message in the last little while is, regardless of how quickly reopening happens, we know there's going to be increased contact and exposures. Everyone who is eligible for a booster at this point in time should be getting that on top of their first 2 doses. And anyone who hasn't got their first 2 doses yet, as Dr. Razak says, we don't know. This may very well be the final wave, knowing that we've already shifted our approach to a more transmissible variant. The guardrails are coming off, and remaining unvaccinated really puts you at a severe risk compared to others. 6 times higher hospitalizations and 12 times increased risk of ending up in the ICU. So vaccination and boosting, that's ultimately what I think people should be taking away, regardless of what reopens on what timeline.
Dr. Razak, as a member of the Science Advisory Table, where does the Science Advisory Table sit right now on your sentiments based on the evidence on the removal of masks in indoor spaces? This seems to be the one thing that the provincial government is constantly unclear as to what the timeline would be for that.
Yeah, I think that you've heard a lot of questions around government policy around the reopening. I'm not hearing as much right now about removing the mask mandate. The reason why I think that it should be one of the last things to go is that many of the other things that are in states of restriction right now have severe impact on society, like capacity limits for businesses, things that affect school capacity or our kids being in schools. But many of those things you can start to aggressively roll back the restrictions, get people back towards normal life while using a mask as your layer of protection, ensuring that the numbers are stable and pulling back on that at the very end. And the other point that Dr. Loh made, I can't emphasize enough, it's vaccination at the same time. So for individuals, there are not that many things within their control. And, in medicine, there's few things that are as protective as these vaccines. And so those things at the individual level, the masks, getting businesses back open, getting schools running properly, all the things that we want to see. And then when we really feel comfortable with the numbers pulling at masks, I would say right towards the end. That would be the hope.
And what would you say the end is at this point? I mean, do you anticipate that's April, May?
Very hard to say. If you look at our modeling, you'll see some of the widest ranges that we've ever put out in our modeling briefs and projections. And the reason for that, of course, is that testing is no longer reliable as a way of detecting case rates in the province. And so we're relying on all these other measures, and they're not as good. We're relying on wastewater. We're relying on screening that's done on businesses. And so it's hard to predict very far into the future, but right now the trends are very positive. So we have weathered an incredibly difficult wave yet again in this province. Numbers are clearly coming down. In the hospital, we're feeling a lot better. Let's get to the point where things are back running as normal as possible. I think we'll have a sense of that and be able to pull back. And like anything else, just do it cautiously. Keep an eye on the numbers. If things start to look like they're moving the wrong direction, you have to respond quickly.
Yeah, do it cautiously. Dr. Razak, brings me to my next question for you. Given the vaccination rate in the province, is the Premier being cautious enough in this potential new plan?
So our 2-dose vaccination rates are excellent. They give you a lot of protection against severe disease. There is a real gap and an opportunity for the booster dose for everyone who is eligible. And there's a gap in the second doses for our younger children. So there are still some gaps to make up. As a parent of a young child, I have 2 children under the age of 5. I am really looking forward to the date that they can be vaccinated. We're not there yet, but for kids 5 to 11, there's a real opportunity to get that second dose. And for adults, that third dose, which gives you that really robust protection. So 2 doses are excellent. They protect you against severe disease. Let's get that third dose in. I don't think that you can wait for the third dose numbers to come up to do greater stages of reopening because truthfully, they have slowed down. And so I'd like the public to go out and do that. It's part of your duty to get our economy and other parts of our society reopened.
So, Doctor, I just want to clarify. So you would be okay with a faster timeline? I just want to clarify that.
My personal feeling is that the 3-week timeline, the original timeline, is reasonable. I can't say that I have strong science or numbers to argue against something slightly faster. All I would say is we've had enough times we've had to lurch back. My personal preference would be go with a slightly slower timeline for reopening. But I understand the pressures. The pressures are real, and people have really suffered, and another holiday season gone. So I understand those pressures.
And Dr. Loh, we had Mayor Patrick Brown on yesterday, who is also pushing in a number of ways for a swifter reopening. Are you satisfied that the province is ready based on some of the latest metrics, based on the data?
I think it's ultimately in all of our hands, and we've done a tremendous work here in Ontario. Our first and second dose coverage is significant. Our third dose coverage continues to grow. But I think the message that you're hearing tonight is, the metrics, the trends are looking good. We're looking like it's possible to reopen either on a cautious timeline or perhaps even something faster. But for greatest certainty, it's really up to all of us. If you haven't gotten your first 2 doses, making sure you're getting your first 2 doses. If you haven't gotten your booster, especially if you're over 50, to get that additional protection. And then, of course, to continue with the masking, to continue staying home if you're sick. Regardless of what reopens, those are all things that we can do individually to reduce our risk, and which will also then reduce our risk at the collective community level as well.
Okay, Dr. Loh, Peel Region's Medical Officer of Health. Dr. Farhad Razak, who is on the COVID-19 Science Advisory Table for the province. Doctors, we appreciate both of you coming on tonight. Thank you.
Thank you.